All right, y'all, sorry for the wait, but today, let's talk about the top 5 trends in plastic surgery for modern women. All right, so at number 5, with Atlanta being the mecca of plastic surgery, is skin tightening. So skin tightening is usually done along with some other type of procedure, and it's something that can be done either in the office or it can be done while you're asleep. Now there's different modalities. This includes Renuvion, which was formerly called J-plasma, and basically what that is radio frequency. And basically what it does is some sort of probe is placed underneath the skin, and it causes your collagen to become damaged and your body regenerates or creates new collagen. Another device by InMode, which is face tight or body tight, or Morpheus. Morpheus can be used in the face or any other part of the body. Face tight, self-explanatory. Body tight, same version used on the body. And again, this is radio frequency. Another device, Vaser, which is used along with liposuction. This is ultrasound type energy, and basically it's heating up the under surface of your skin, leading to skin tightening. All right, y'all, let's get into number 4, BBL, which is Brazilian butt lift, liposuction, abdomen flanks, your back, and with fat transfer to your buttocks and your hips. This gives you a nice Coke bottle appearance. Very popular procedure. All right, at number 3, we have tummy tucks, or it's also a medical term for that, abdominoplasty. So, you know, you got those ladies, they want a flatter abdomen, they want to get ready, you want to be on the beach and have your shit just like flat, like flat, tummy tucks. Now with the tummy tucks, make sure you go to the right plastic surgeon, because they need to do a little bit of lipo to get you that great result. So that leads me into number 2, which is liposuction. So liposuction can be done either awake or asleep. So, you know, you need a little area touched up, or you've been going to the gym and you're trying to get ready for summer and you just have that stubborn area around your flanks or right here, you want it just sucked out, you just want that Coke bottle? You can just get a little bit of lipo. And so when we're speaking about that lipo, don't forget, you can get those energy devices along with the lipo. You can get it all at the same time. All right, y'all, we're at the end of the list, but before we get to that number 1, I like to just reintroduce myself. I'm Dr. Nicholas Jones. I'm the founder, CEO of Nip and Tuck Plastic Surgery in Atlanta, Georgia, and I do cosmetic surgery, BBLs, breast surgeries, tummy tucks, everything on this list we do right here in Atlanta. And we have patients locally, and we also have patients who come from everywhere. I'm talking about New Orleans, London, Dallas, Vegas, wherever. We can take care of you right here. And if you need some information, or if you're interested in a consult, just go to our website and fill out a contact form, and we'd be happy to take care of you. All right, y'all made it to the top of the list. Let me get a drum roll. All right, number 1, and still number 1, is breast augmentation. So breast augs has been very popular in plastic surgery, and a lot of people think about plastic surgery, they think about breast augs. So what a breast augmentation is we put in an implant, whether it's saline or silicone. It can go above the muscle or under muscle, and it's basically to increase or enhance the breast. So a few things to know about breast augmentations is, number 1, everyone isn't a candidate for a breast aug. So if you have really droopy breasts, you can't just get a breast augmentation and have those perky breasts. You may need to have a breast lift with the augmentation, and a medical term for that is an augmentation mastopexy. Other thing you need to know is there is a difference between silicone and saline implants. One of the most important factors when you're deciding on the type of implants is the width of your chest. So if your width of your breast is only this wide, that means the selection and type of implants that you can get have to fall within that parameter. Otherwise, you end up with a uniboob, or you have your boobs hanging off the side of your chest. And there's different approaches to putting in the implants. The most common, most popular is an inframammary fold approach, where there's a small incision placed underneath the breast to put in the implant. There's also the periareolar, where there's an incision made around the nipple, and then there's a axillary approach. With the axillary approach, typically you can't put in as large as the implant. With the saline implants, the incision can be much smaller, because with the saline implants you actually put in the implant first and then you fill it to the volume you would like, as opposed with the silicone, the volume is already in the implant, and so you have to make a larger incision. And before I forget, I'm so sorry, I don't know, I was tripping, but there's also autologous augmentation, and basically that is a fat transfer to your breast. So we can take fat from other parts of your body and inject into your breast and to give you more volume. The downside of using your own fat is you can't control the shape as much. Like the way that your breasts are shaped are pretty much it. Now the fat can be placed subcutaneously within the breast tissue, and then also it's placed submuscularly to give you more projection. All right, thank you for tuning in. I hope you got some value from watching this video. And if you're someone who is looking to lose some weight, or you've been thinking about pursuing a weight loss journey, please watch our next video. We got some great information for you.